Hi, my name is Alana. I am a registered dietitian currently working in the healthcare setting. I have always had a passion for healthy eating and encouraging others to do so. I find it fascinating that with a healthy diet, we can not only prevent certain diseases, but also feel better, perform better, and live longer. My second passion is the environment and how we as a community can work together to preserve our planet. At my current job, I provide health education to residents, families, and employees on a daily basis. However, it is mostly nutrition related. My goal after completing the public health degree would be to land a job that would include both of my interests, nutrition and environmental health. As Schneider stated in her book, improved nutrition and a cleaner environment are two major reasons people are much healthier today than 150 years ago. I would love to help people make better choices for themselves and their environment as related to food, recycling, air quality, transportation, water usage, gardening, etc. As stated in this week's lecture, from 1900 to 1999, the incidence of stroke and heart disease reduced significantly as people became more aware of the risk factors for the disease, with diet and exercise playing an important preventative role. Similarly, knowledge of folic acid supplementation during pregnancy cut the incidence of neural tube defects in half. I believe that as research continues, new discoveries will be made that will allow for better education to the public. A more recent nutrition-related finding I have heard of is the connection between red and processed meat consumption with cancer, heart disease, and increased mortality risk. As stated by Schneider, up until the 1980s, people were still blinded to public health issues, such as environmental pollution and increased medical demand for the elderly. These continue to be ongoing issues today. The problem we have is awareness. Schneider states more attention is given to medical care rather than public health. Medical care relating to solving the current problem, whereas public health pertains to the prevention of the problem before it arises. Only 3% of the nation's total health care spending is spent on public health. The unfortunate truth is that more money and lives could be saved through public health, also known as prevention, rather than medical care. My goal once completing this degree would be to develop new ways and ideas to better inform the public of our current health issues. When people are aware of the consequences or possible outcomes, they are more likely to make a change. The first step is knowledge. For my evidence-based program, I will be choosing tobacco prevention and control.